Hello and welcome. I hope all of you are well. My name is Garbia Bailey, and I will be your moderator for today's symposium. Welcome on behalf of the McKinnon Trauma and Recovery Lab FAC Project, Healthcare Salute. This is symposium number 2, Risk and Resilience in Healthcare Providers during the COVID-19 pandemic. Now, before I go much further, it would be rude of me not to share a little of myself with you. I am a journalist by trade, a storyteller by nature. I'm honored to be with you today. My own family came here from Jamaica in the 1970s, and we continue to be ever so fortunate and grateful to have come to this country on this land and on this territory as immigrants and settlers. I live and work on land that we recognize as the traditional territories of the Haudenosaunee and Anishinaabe nations, and recognize and act on the responsibility that comes with that. I'd also like to acknowledge the land on which McMaster University is located, which is also the traditional territory of the Haudenosaunee and Anishinaabe nations, and within the lands protected by the Dish with One Spoon Wampum Belt. That wampum uses the symbolism of a dish to represent the territory and one spoon to represent that the people are to share the resources of the land and only take what they need. Further to that, the Truth and Reconciliation Commission 94 calls to actions and reaffirms that the treaties with Indigenous peoples must be lawfully honored. We are all treaty peoples and are responsible for honoring and upholding those agreements. Again, I welcome you to this symposium. Over the past close to 3 years, we've heard much about the strain of the healthcare system and on healthcare providers due to the pandemic. This research project seeks to shine a light on the impact that the pandemic has had on the mental health of all those healthcare providers who have given and continue to give so much of themselves. So some of you here today will hear, it will be a difficult process. We're going to hear a lot of stories. We will be discussing instances of moral distress and moral injury and the challenges at home and at work that healthcare providers have faced and continue to face during the COVID-19 pandemic. We'll be here together for a while, so take the time you need. If you need to break, please do so. Step out, breathe deeply, do whatever it is necessary to take good care of yourselves. We also have links in the chats that link to wellness support. Take a look, and if you need anything, please do take advantage of those resources. Please note that there is closed captioning and transcription and French translation available for this event. For those who would like to access those services, you'll see interpretation on the bottom of the Zoom screen, and you can just hit that and you can have this in French or English. A huge thank you to the Public Health Agency of Canada and all of our partners for their commitment and support. This symposium is being recorded as part of a broader research project. So you'll have the opportunity to revisit the information that you'll take in today. There is an open chat function for this virtual event. Please be respectful in your interactions and try and keep the chat on topic. And it would be great right now if you're here to get a sense of where you are logging in from. I'm sorry that I don't have any prizes for someone that's coming from far away, but we should test this chat function really quickly. Where are you coming from? Remember that each section today will also be, Innisfil, St. Thomas, hello. Winnipeg, hello. Good to see you. Each section today will be open to audience questions. You can use the Q&A box to drop in your questions. Again, at the bottom of your Zoom screen, you will see the Q&A box. Now, we won't be able to get to all of your questions, but we will do our best. Now, links to the extended bios of all participants can be found on the screen. It's as important. So if you're hearing someone speak and you want to learn more about them, you'll see that. The sessions will be in 3 parts. 12:15 we'll take a break. And that, my friends, is the how of all of this. happening today. Now I want to tell you why this research is a crucial part of establishing the spirit of today's session. And with that, I'd like to introduce and welcome Dr. Margaret McKinnon, who leads the team on this project. Hello, Margaret.
Hello, Garbia. It's lovely to see you.
It's wonderful to see you as well. Now, can you tell me first what you and your colleagues were hearing, seeing, experiencing that kind of set the table for conducting and collating this research that we'll go through today?
Thank you so much, Garvia. And, I want to begin first by thanking those of you who are here today for your service. I've worked for a very long time with the military, with veterans and first responders, and we often say we salute you for your service. Today, we would like to salute healthcare workers across the country, in North America and beyond, for their service during the pandemic. In many instances, it's felt like we've been on war footing over the past 3 years. And as a clinical psychologist, I have the privilege of being on some of the COVID-19 and ICU units to provide mental health supports to healthcare workers during the pandemic, and to hear their stories, to learn of the sacrifices that they and their family members were making, and to see the distress that many of them were in over the course of the pandemic as it now continues and into the aftermath, we hope one day. We just want to be there to support healthcare workers, to hear and know their stories, and also to thank them for their service.
Mhm. Now, Margaret, why are risk and resiliency in tandem for our discussion today?
So much, Garvia. All of us have individual reactions to what's happening right now. And for some people, there will be things that contribute to resiliency, to making things a bit easier to cope with what healthcare workers are facing. There are also factors that contribute to risk. And we know, for example, having experienced childhood abuse and neglect, for example, can make one more vulnerable to experiencing strong emotions during some of the situations that people face. We know that not having a support system or not having access to a support system is also very much a risk factor for experiencing mental health difficulties. And during the pandemic, what we heard from many healthcare workers, we've interviewed over 124 healthcare workers across the country and surveyed close to 600 now. And what we hear is that, during the pandemic, there were access to gyms, being able to see friends and family. These were things that often weren't available. And so we want to look at what are some of the factors that help people on their mental health journey, and what are some of the factors that contribute to risk. If we know what those risks are, and we're going to hear that today from some of the work that we're going to hear about, then we can target these areas to try to prevent, or at least to help heal some of the difficulties that mental health workers face. So for example, can we set up social support systems? For example, via the internet or other means where we can support healthcare workers and what they're facing. Being on the units, what I saw so often was the strengths of team, right, and the strengths of togetherness. And healthcare workers often talked about how they didn't want to go home because they felt they were letting their team down. We want to find that space for self-compassion and putting the oxygen mask on ourselves so that we can help others, and also strengthening and building our teams.
Absolutely. We're going to have a very deep conversations today. We're going to hear a lot of stories, and I wonder about where you'd like this conversation to go next. Once we've, all the research is done, we've had all this what I will probably, I think is going to be like a real groundswell of support for this project. What happens next?
Thanks, Garvia. And, I'm going to think about where I was last night. So I was speaking to the Saskatchewan Union of Nurses, and, what we've heard in these interviews from healthcare workers, the first thing that they ask for is for people to know their stories. They don't want to have to tell the stories over and over again. Many people feel alone in the struggles that they face. And they want policymakers, they want clinicians, they want members of the public to know what these struggles have been. When we think about how we support healthcare workers, it's both thanking them, knowing their stories, and setting up systems and supports that will be available to these healthcare workers. A lot of the work that we're doing for the Public Health Agency of Canada and other groups across the country are doing is really to set up concrete supports that are available to healthcare workers and also first responders and public safety personnel who have served and other essential workers who have served over the course of the pandemic. I think at the federal level, we really want to talk about organized supports that are equitable and available to all Canadians. So we think about individuals, for example, who are joining us from the Northwest Territories today. How do we ensure that the supports that we provide are available to all Canadians, those who serve, and also the general population who has really experienced a lot of mental health difficulty throughout this as well? But we place here a very special emphasis and a very special thank you to those who have served at great sacrifice, not only to themselves, but also to their families. And we've heard from nurses, physiotherapists, occupational therapists to say, when I get home, I have 2 words maybe left for my family. I'm so tired. We know that the partners, parents have taken over caregiving responsibilities. So collectively, there has been a great deal of service and sacrifice, and we need to be available and have mechanisms to support those individuals and their families.
Yes, absolutely. Well, thank you so much. We're going to dive in right now. Thank you, Margaret. Now I'm going to turn it over to Dr. Kim Ritchie and Mina Pichkova with a summary of the research findings on moral injury in Canadian healthcare providers.
Hi everyone, my name is Mina Pichkova, and today I'll be presenting alongside my wonderful colleague, Dr. Kimberly Ritchie, on the topic of resilience among healthcare workers. So before we get started, it's important to highlight what resilience is and why it's so important. So there are a lot of different definitions of resilience, but the most straightforward one, and the one that we've used for the purpose of this study, is that resilience is the ability to bounce back or recover from stress. And what resilience really allows one to do is to cope with adversities that occur during stressful periods, which may otherwise trigger mental or psychological problems. And to highlight that point, there's ample evidence to suggest that during stressful events such as disasters or disease outbreaks, in the case of the COVID-19 pandemic, people are more likely to suffer negative mental health and psychological consequences when they're not equipped with ample levels of resilience. Now, this is especially true for healthcare providers in recent years during the pandemic, as they've repeatedly been faced with increasingly stressful situations for a very prolonged period of time now. And now what we're seeing is that as a result, healthcare providers have suffered an immense deterioration in their mental and psychological health during the pandemic on a number of different measures, including anxiety, depression, burnout, PTSD, and psychological distress. And they're experiencing this deterioration in mental health at higher levels than the general public. So that being said, resilience isn't something that's set in stone, and it can be influenced either positively or negatively by a number of different factors, including individual factors, organizational factors, or even societal factors. So all those things considered, resilience is an incredibly important concept for us to explore. And what we'll be talking about today is our study on the relationship between resilience and a number of different variables, including mental health, burnout, organizational support, and social support, just to name a few. And ultimately, doing this is incredibly important, as it seems that resilience is likely a strong safeguard of mental health among healthcare providers. And exploring these questions will ultimately allow us to develop and implement interventions that are aimed towards using evidence-based interventions to enhance resilience and strengthen healthcare providers' defenses against the various mental health and psychological consequences of the pandemic. So just to give you a little bit of a brief overview of how our study was set up. So we started off with the recruitment stage, where we invited Canadian healthcare workers who were directly or indirectly involved in patient care during the COVID-19 pandemic to participate. And the first thing they did was fill out a collection of online questionnaires. So a total of 460 healthcare providers filled out the questionnaires, May 2022 to January 2023. And then some of those participants were also, that indicated they were interested in being interviewed, were invited to a virtual interview. And the interview was semi-structured and it was kind of to get more into the nuances of their experiences. And then a quantitative and qualitative analysis was done on the questionnaire data and the interview transcripts, respectively. So in terms of the demographics of the individuals who participated in the study, the average age was 43 years old, and about 50% of our participants were nurses. The majority of them came from the province of Ontario, specifically 64%, and 89% of them identified as female. So now the questionnaire that we use to capture resilience. This is the Brief Resilience Scale. And essentially, like we discussed earlier, it assesses one's ability to bounce back or recover from stress. And I've put the items up here just so you can kind of get a sense of the kinds of questions people were asked. And the Brief Resilience Scale is an established, reliable, and valid measure of assessing resilience. So now that we know why resilience is so important, let's explore what story does our data tell us? And unfortunately, it's not a very good one. So out of the 460 participants, 51% scored in the range of low resilience. 45% scored in the normal resilience range, and only 3.5% scored in the high resilience range. So what we did next was a correlation analysis, which is essentially just a statistical test to explore how variables are related. Specifically, we were interested in how resilience is related to all the variables that I've listed here in blue on the right. And all of this was done using the questionnaire data. And what we see by this is that resilience is significantly negatively correlated with all these variables in blue, which means that people who reported higher levels of resilience reported experiencing less moral injury, PTSD, burnout, insomnia, depression, anxiety, stress, and emotion dysregulation. Now, PTSD and moral injury is something that we're hearing about a lot lately amongst healthcare providers. And so we thought it would be worth it to explore these two variables further. So along the horizontal axis, we have resilience, specifically low, normal, and high resilience. And we see very similar trends amongst the two graphs. So on the graph on the left, we're looking at how resilience is associated with PTSD symptoms, which were assessed using the PCL-5 questionnaire. And what we see is that individuals who have low resilience have significantly higher levels of PTSD symptoms than those with high resilience. And then the same trend is seen on the graph on the right, which explores moral injury. And that was measured using the moral injury outcome scale. So once again, we see that individuals who have low resilience experience significantly higher levels of moral injury than those with high resilience. We also looked at a number of questionnaires related to organizational, social, and self-compassion factors. And what we see here is that resilience is significantly positively correlated with all these variables. So what that means is that people who reported higher levels of resilience reported experiencing more organizational support, more self-compassion, more social support, and more productivity in their workplace. Interestingly, resilience was also associated with the years someone has worked and their age, such that individuals who had worked in the field longer or were older reported higher levels of resilience. So now I've just put up the actual names of the questionnaires that we use to capture these different factors in case anyone's interested. And now I'm going to pass it off to my colleague, Dr. Kim Ritchie, who's going to explore the qualitative bit of the study a bit more with you.
Thank you, Mina. And as Mina mentioned, my name's Kim Ritchie, and today I'm going to present some of our preliminary findings from the qualitative part of our research. And in this part, we took a deeper look at some of the work and personal factors associated with resiliency of healthcare providers during the pandemic. For this part of our study, we included healthcare providers who'd completed an interview in addition to the survey. And we included those participants who scored either in the lower or the higher ranges on the Brief Resilience Scale, which was part of the online survey. We then analyzed their interview data in two groups: the healthcare providers who had lower scores on the Brief Resilience Scale and those who scored in the higher range on the Brief Resilience Scale. This analysis included 23 participants in total, and they represented several different healthcare occupations, including nursing, occupational therapy, respiratory therapy, and so on. In our analysis, we found three themes that cross-cut the lower and higher resiliency group. Today, I'll share those three themes along with a quote from each group to describe that theme. In the first theme, participants in both groups described many similarities in the type of coping strategies they utilized during the pandemic. Overall, many participants reported the pandemic had a drastic impact on their ability to practice usual coping strategies, with the loss of going to the gym or visiting friends and family and so on, especially during the periods of lockdown. And because of that, they really had to adapt and develop new ways of coping. The most common coping strategies found in both groups was an increase in their use of alcohol, use of marijuana, sometimes for the first time, eating more, increased use of social media, going for long walks, and increased risk-taking behavior. And these were all ways to manage the increased stress they were experiencing during the pandemic. So for example, the quotes on this slide in both the higher and lower resilience group report similar increased use of alcohol as a way to help them cope with their stress after work. Several participants also reported that they recognized that they were struggling and they had a lot of increased stress. They were to the point of exhaustion, and they came to realize that they had to really prioritize their own self-care over their need to care for others. And we heard also about this from healthcare providers in both the lower and higher resilience groups. And they talked about having this real difficulty or even a tension when it came to prioritizing their health and well-being over others. And the reason for this was that healthcare providers really see themselves as individuals who care for others, and it is a big part of their identity. Therefore, it's really hard for them to turn that same care towards themselves, or even to balance care for themselves with their care for others. Some of the healthcare providers we talked to reported that they had to give themselves permission to care for themselves. And this was the word that they used over and over again in the data. Sometimes some healthcare providers said that they were able to give themselves permission to care for themselves or to balance caring for themselves with others. And others said that they really wanted and needed this permission to come from someone else, such as a family member, a colleague, or even a supervisor. And having this permission given to them really helped them to resolve some of this tension or guilt they were experiencing when it came to turning that care towards themselves. And the last theme today really focuses on the types of ways organizations supported healthcare providers during the pandemic. Most of the healthcare providers we spoke with talked about long-standing challenges related to being short-staffed, which was, of course, amplified during the pandemic and contributed to their increased workload and stress. Where there were differences in the data, though, between the two groups was in how their healthcare providers perceived their organizations manage some of these increased work challenges. What we found was that healthcare providers in the lower resilience group reported that they didn't feel supported or their organization wasn't receptive to their opinions. So it didn't feel safe to them, or they didn't have an opportunity to voice their opinions about some of these challenges they were experiencing. Whereas healthcare providers in the higher resilience group talked about having a more open environment in their organization, which was flexible. There were established channels of communication through regular meetings or even daily huddles. And during these times, they felt able to give their thoughts and opinions, and they felt their voice was heard. So in conclusion, what we found from our research was that healthcare providers with higher levels of resilience may experience less negative mental health symptoms such as PTSD, moral injury, depression, anxiety, and stress. Higher resilience is also associated with healthcare providers who have more social support, more self-compassion, and perceive more supportive organizations. Secondly, healthcare providers with both higher and lower levels of resilience have similar types of coping strategies and difficulty prioritizing or balancing their own self-care. But there's differences in their perception of how their organizations were able to support them during the pandemic. Thank you very much.
Thank you very much. That was fascinating. Dr. Kim Ritchie and Mina Pichtikova. I do have some questions for you, and I'm sure the audience will have questions as well, those that are listening. And just a reminder that if you'd like to ask Mina and Kim any questions, you can put your questions in the Q&A box. You see that running below there. And I would be happy to pass those questions on to our panelists for you. But for now, I have some questions of my own, if that's okay. Now, you touched on the personal factors that influence resilience, and I'm wondering if we can unpack that just a little bit for individuals when we go back and take this information and think about what are those personal factors that can be shifted or can be that we can think about in terms of individual resilience. What are those personal factors that influence?
Hi, Garvia. Thank you so
Hi,
much
Mina.
for having me and for this opportunity and for the great question. So like I mentioned earlier, the good thing about resilience is that it's not something that's set in stone, and it's something that can be influenced and something that we can change at the individual or personal level and also at the organizational level. In some ways, to build resilience on a personal level is through connection, for instance. So building connections with those that support you, because it's very easy to isolate yourself during hard times. But building a sense of community and being around people that have a common understanding can really allow you to connect with others and overcome challenges as a group, and really allow you to bounce back from that stress. And then another thing is taking care of your personal wellness. So stress is not something that's just felt psychologically, but it's also felt in the physical body. So of course, self-care is often easier said than it's done, but it's important to make it a priority and give yourself that self-compassion and that space to take care of yourself, like Kim was mentioning earlier. Yeah, and take care of the stress, not only emotionally, but physically, so that you kind of have the ability to push through. So this can be like little things that people build into their wellness routines, getting enough sleep, exercising, building healthier habits, and even small changes can make really kind of big effects down the road. And another thing is healthy thinking. So acknowledging and accepting your thoughts and emotions during stressful times. It's very natural for these thoughts and emotions to come up. And giving yourself grace when they do come up. So kind of reflecting on your thoughts. Are they positive? Are they negative? Are they realistic? Are they grounded in fact? And identifying areas of hope that you can lean on, as well as accepting certain circumstances that can't be changed right now, and focusing on the things that you can change. And finally, finding meaning and purpose in what you're doing. Of course, healthcare is an incredibly meaningful and purposeful profession, but kind of celebrating your own strengths and goals and moving towards your values or something that can kind of help foster that resilience.
Yeah.
But yes, just as much as, there's these factors that are individual that influence resilience, like I said, there's also the organizational and societal factors that play a huge role.
Mm.
So it's also important to shift away from thinking about this as just a personal responsibility and also
Mhm.
thinking about it as a societal and organizational responsibility as well.
Mhm. Yeah, absolutely. The it's interesting because I feel like the personal part of it is a lot like working out. Like it's a lot
Mhm,
like the things that you're supposed to do for your body. You think to yourself, I need to think in this way. I need to do these things and give myself permission to feel these feelings and build my resilience. But um there's another part of you that says, I'm just so tired. Like I'm too tired to think about taking care of myself. I'm too tired to think about going to the gym or, of my own self-care. And as your research shows, so many people are preoccupied as well with taking care of others.
mhm,
Um, so I wonder about those small, um, the way to perhaps implement the smaller parts of building up the strength. Like when you go to the gym, you build up the strength to be able to
mhm,
do the heavier lifting. Um, uh, how you, what those small bits of that personal part, and then the occupational part as well. The small
mhm,
things that employers or those around you, communities can be doing.
mhm. Yeah, that's a great point. And that's kind of the catch-22 that we're seeing. On one hand, self-care, resilience, wellness, it's incredibly important. And it's like a muscle that you build up. But then when there's not the space and the time and people are so burnt out that they don't have the capacity and it just feels like yet another task and yet another responsibility, that's kind of when we get trapped in that vicious cycle. And I think that's why it's so important to highlight um, the organizational factors that can influence resilience and to shift away from considering resilience as just at the individual level. That's fully solvable by people making life changes, because that we're seeing that that's not the case. Um, and we're starting to shift away from thinking about it in that way, and kind of shifting some of the responsibility towards the workplace environment.
Mhm.
Um, and that includes things like creating realistic and compassionate team culture where people can have honest conversations with one another. Um, Organizations being vigilant about the risks associated with the profession and monitoring ongoing stressors for healthcare workers, having proper staffing,
Mhm.
having opportunities to discuss work-life balance without fear of repercussion, um, having a shared responsibility to identify the sources of stress and take the appropriate measures in the workplace. Um,
Yeah.
yeah, and I think a lot of this comes down to also just having really clear organizational support and having policies that protect healthcare providers as well, um, so that there isn't fear of repercussion if individuals are bringing up any sort of organizational concerns.
That's
So
great.
yeah, I think it's
Mhm.
definitely a delicate dance between the two.
Mhm.
And there are things at the individual level that, you know, can allow people to build up a resilience toolkit. And then there's also responsibilities that um, are more so on the workplace, are more so organizational.
Now, on the level of the research itself, there's a question from those listening here about the physicians that did the survey. Were there many physicians that did the survey, or what sorts of people did you hear from?
Yeah, so in terms of our demographic breakdown, the majority of the individuals that responded to this particular phase of our study were nurses, physicians, and personal support workers. So that was generally the biggest breakdown, with about 4% being physicians
Okay, thank
and
you.
51% being nurses.
Great. This is an excellent question that comes from our audience as well. What is the role of education in clinical ethics to build resilience? Big question. We don't have a half an hour or an hour or another symposium to answer it, but what is the role of education in clinical ethics in building resilience?
Mhm.
I think that's such a great question. And we've had lots of discussions about that in our own team. I think the one of the questions that we asked in our interviews was, have you ever received education on mental health issues for yourself as part of your training as a healthcare provider? And we've only had a very small handful of people who've responded that they had. So I think that speaks to the broader need for education for healthcare providers about mental health, period. About taking care of their own mental health, about the types of exposures that they're going to face as a healthcare provider, and how to help build some of those skills to actually take care of themselves, how to balance that with the need to patient care, with their own self-care, and then just to learn about mental health for themselves overall. And in terms of ethics, what we've heard a lot about is healthcare providers have talked about really wanting debriefing in the workplace. So this would be where there's an opportunity, maybe there's been a specific issue or challenge in the workplace that is causing you some tension or feeling that moral sort of distress in some way, and that you have the ability to come together as a group or a team, with your own team, or even bringing in some outside supports, and to really sort of unpack that. And the purpose of it is to kind of share your own thoughts and feelings about that issue and how it impacted you personally, beyond sort of the broader sort of, I guess, patient care issues, but it's about turning that inward to look at, how did that issue impact me specifically? So that's one of the things we've heard quite a bit about, is that request in all types of healthcare settings: acute care, community care, long-term care overall. Mina?
Yeah, I just think that's such a good point about the debriefing and the connection. Because when I was talking about resilience on a personal level, I mentioned connection, going out and seeking it. And this is a perfect example how the distinctions between organizational and personal aren't always very clear cut. Because connection does help build personal resilience, but it's also something that the organization can support by essentially building it into the programming, building it into the culture, into the protocols. So I think that was a great point and a great response, Ken. Thank you.
Yeah, thank you, Mina.
Thank you. Thank you to both of you for this presentation. It really is, it's impossible to measure the importance of having not just the research, but now as we move into this next portion of the symposium, of attaching real faces to it. But thank you, Mina and Kim, for this. This has been fantastic. And I'm sure we'll be going back to this as we continue the symposium today. As I said, names and stories, adding the names and stories to the research we are exploring today, very important. So right now, we are so fortunate to have 3 healthcare professionals with us to not only share their experiences, but to also tell us about what has helped and or hindered their ability to care for themselves. Iram Chagala is an emergency and trauma nurse. David Tebb is a physical therapist in general and thoracic surgery. And Todd Tran is an occupational therapist. I welcome all 3 of you to the symposium today. Hello.
Hello.
Hi, thank you so much for having me here.
Thank you, Iram. Thank you, Todd. And I
Hi,
think
Garbia. Thank you.
oh, there you are, David. Great to see you as well. I think it's always the origin story is just so important because it kind of sets the table as to why you're here today speaking and why you do what you do. So can you each of you briefly give us kind of like the Coles notes of what drew you to your profession? And I will start with you, Aram.
So I had actually been through a lot in my life previously. And I would say that going into nursing was something I wanted to do to help others, but I would also say it was the heavy influence of my late father because
Mhm.
he thought that I could and thought that I had the potential to help people in need.
Yeah. Yeah. Todd, what about you?
Hmm. Um, my story is more about going into the healthcare field because I was really interested in the biological sciences in high school. And not to outdate myself, but in high school back then, we had a grade 13, and those
Yes.
grade 13 was called OAC. And I took biology and I really enjoyed it, and physical education, which I really loved about the health perspective. And chemistry was so-so, but then comes physics, not so. So I fell in love with nursing, and which I did my first degree in, but then I switched over to occupational therapy because I love rehab so much. So
Mm,
in a similar vein of helping and contributing to society.
yeah. Yeah. And you, David?
Well, I grew up in a healthcare family. So my mother worked in healthcare as a nurse and hospital administrator. So I grew up around in that environment, and certainly spent quite a bit of time volunteering at hospitals when I was young with physios and occupational therapists. And I had to take a big role in caring for my grandmother post-stroke. So certainly my early experiences really kind of pushed me towards physio as a career, and I just wanted to have a job that had a positive impact on people's lives.
Mhm. Um, so I want you all to take me back to the early days of the pandemic and what you were experiencing at your place of work as the pandemic began to unfold. As really frontline workers, you saw what was happening. Can you just take me back to that and what you were seeing and what might have been going through your mind at the time? I'll start with you, Todd.
Sure. Um, as you're bringing me back to the early phase of the pandemic, it was a lot of chaos. That's the word that comes up to mind right
Hmm.
now. And I laugh at it, but it became more organized throughout the waves. But it was quite chaotic because we were redeployed from where I work in primary care to a variety of roles, from screening to working in the pharmacy of drawing at the vaccinations to giving out the vaccines. It was chaotic in terms of we don't know where we were deployed. We didn't get a sense of autonomy either in terms of people asking in the leadership team of like, Todd, there's a variety of roles. Which one would you like to give options or choice? There was a lack of that. It was more like, you're doing this and you're going to do this next. And even when I was wanting to contribute and be in the vaccine clinic, going to the hotspots of Toronto, we didn't know from week to week where we were going in terms of hotspots. And it wasn't shared and our roles wasn't given. So it was really chaotic, but again, it became more organized along the way. But initially, I just wish that people had more choice in the matter, and also to ask a variety of healthcare workers, is it okay if we do this? Are you immunocompromised? Because we didn't have any vaccines at the time. Are you okay to be in the front line to screen or to do such and such? Or another question would be, are you living with anyone else in your family that's immunocompromised? That conversation would have been lovely at the initial phase versus not.
Yeah, yeah. We'll hear a little bit more about that. Aaron, what was happening with you in the emergency room, in the trauma centers? What did those early days of the pandemic look like?
I would say crazy.
Hmm.
You didn't really have time to think. You saw people being rolled in by EMS stretchers one by one, one by one. You would get calls in advance saying that we have a cardiac arrest because they were short of breath. We had to get people on life support within 5 minutes of arriving. We barely had bed accommodation space. We had to make some very hard decisions. ICUs became jam-packed. We were outsourcing or sending patients off to other hospitals in different regions. It was heartbreaking to speak with families on the phone who couldn't be there physically in the presence of their family or their loved one who was dying. To hear them on the phone, to see them on FaceTime was probably the only way that they could communicate with their families. We saw all age groups get very ill. And I would say that there was absolutely no time to think. Information was so ever evolving when you were triaging. It was like you were trying to update yourself day-to-day basis, hour-to-hour basis in terms of what we were screening for. At times, we were even deployed from the emergency department to screening centers, and we were triaging up to maybe 500 to 600 people in a day
Wow.
that may have been exposed or had symptoms that may have not even been COVID, but just because it's such a novel disease that you had no idea what symptoms could arise. And I would say the unforgettable was also how many bodies we had to bag and send down to the morgue. That was what COVID started as and continued as.
Yeah. And, Todd spoke about being redeployed, and folks in different jobs found themselves doing things that they would never have imagined, like, taking care of the deceased. David, you were also redeployed during the pandemic in those early days. What was going on for you? Like, how were you processing what was happening, the chaos that Todd and Aram talk about, and being redeployed, all of those things?
Well, it was certainly very challenging within the health center itself. It was like Todd was saying, just very chaotic. Novel virus. We didn't have much information about it. Even being able to judge like my own personal risk to the virus, just with other kind of healthcare factors. With my regular job being in orthopedic and general surgery, like we stopped a lot of the elective surgeries. So I was seconded to work in the ICU for quite a while. And, I do have ICU experience and I'm used to working with those level of patients, but kind of being able to prepare myself for the symptoms and just the unique level of care that those patients with severe COVID pneumonia required was challenging. And there's really no preparation for that. I mean, you just had to, you're working with a novel virus. You just had to kind of do the best to your ability and using good sound clinical judgment. It was even more challenging for myself when we went to the ICU. Was we weren't just doing day shifts, so we were seconded just because of a lack of staff in general. So we had to do 24-hour shifts, like 24-hour coverage, with very little time to really accommodate to the just to going from day nights, and actually little like maybe having one day in between to accommodate from night to day and so forth. And that was certainly challenging. I have a lot of newfound respect for our nursing colleagues that do that on a normal. But that certainly left me in a situation of trying to cope with just a stressful situation of change a job, but then also having to do it without like sleep deprivation and certainly not having my other avenues for self-care. A lot of the care I was having to provide was a little out of scope of practice. There was limited things that a lot we could do from a mobilization standpoint with patients, but having to help bag bodies, speaking to families, bringing them in the middle of the night to be able to kind of say goodbye to their loved ones was certainly challenging. And another thing that also made it tougher was, a lot of different professions certainly received some, kind of, acknowledgement from the government and monetary supports through pandemic pays. But physiotherapists were one of the groups that didn't. So there we are, 6 of us around a patient proning a intubated patient, and only one of us was not getting kind of any monetary supports or with the pandemic pay. So that was it. It was just kind of knocked you down a little bit further.
Mm-hmm, mm-hmm. It speaks to the moral injury that we've uh, uh, alluded to. Was there a moment for each of you when you started to feel that feeling of we're in a place now that we've never been to, and you started to feel the personal risk of of where we were in the pandemic, where you were in the work that you were doing? Was there a moment that you can think of that where that sort of the tides turned, let's call it that? I'll start with you, Todd.
I think that's a great question. A great question because there's multiple times that I felt that way.
Mm,
But I think it to me is the tide that turned was the convoy freedom protest that really
mm,
threw me off guard because um, it because speaking from my experience as a double minority, as an Asian man, but also as a gay man, um, two of those narrative that I have is going down to psychological safety because of COVID, being Asian, not a good time to be Asian. Um, and then on top of that, being a gay man, but then the third thing that really came on board was the convoy freedom protest that they were coming to Toronto on a particular weekend. And the messaging from my organization was, do not wear or identify yourself as a healthcare worker just because you might be targeted. So that was a really turning point where it's like, what is going on in the state of the world where there's 3 hats that I have, 3 identities, and I can't show all 3 perhaps, or it's not safe to have those 3 identities. So psychological safety was really at the foreground for me in my experience during that time. And that's a new social phenomenon. It's a triple minority, right? Where
mm,
do you feel safe? Can you be yourself? It's like feeling of hiding oneself during this pandemic was really interesting, which highlighted that. So
mm.
that was a really takeaway where it's like, what is going on in the state of the world?
I think that was just from a layperson's perspective, that was a real turning point for many people watching. The fact that you were unable to, when those messages were going out that don't identify yourself as a healthcare worker, when 4 months prior to that you were standing out and banging pots and pans for healthcare workers. So Aaron, what about you? Was there I know that you experienced something very traumatic during the pandemic, and having your father being hospitalized and coming into the same hospital that you worked at as a COVID patient. Um, I mean, I can't even call that a turning point. Can you tell us just a little bit about that and how you were um, processing that situation?
My heart dropped into my stomach. Watching people struggle to breathe and die is a very difficult thing.
Mm,
When you see it happen to someone that you know and love, it makes it much more difficult. I would say continuing to work on the front line while my father was hospitalized in the ICU was a way for me to be connected with him physically and spiritually at every point in my life at that time, because I really believe that was his journey, but it was also part of mine. it was me working 12-hour shifts or more, and then walking over to the ICU just to see what was going on. Feeling frantic, getting phone calls. I think it was also very difficult at times, hearing a code blue alarm go off up above in the announcement in the hospital, because naturally you would wonder and think, is that someone that you know? Watching the news, really stressed out, hearing about things such as, new laws and new decisions that were being made about certain age groups being taken off of life support was very, very difficult for me. But also to add on to, what was mentioned just now about the convoy protest, and then having patients come in and become irate and physically and verbally assaulting you in the ER, and to the point where a lot of them did not want a mask because they didn't really believe this disease was real, or refusing to get vaccinated, was something that really affected myself, but I think it also impacted a lot of my colleagues that worked with me alongside with me, because there were so many people that would have really wanted that vaccine. My father was one of them. He was too late by 1 week. And so he then became ill and ended up on life support, where he fought for his life for the hardest month. That was one hard month. That was a very hard month. So I would say that there were so many people that would have really wanted that vaccine so that they could just have that chance to live and be alive. And so many people that I've seen sick just because they couldn't get a vaccine. And I think that's what had angered me, and a lot of us felt so angered about those who were, and we do understand that there's questions that people have because it's such a new disease. But can you imagine, is that really worth your life? Because so many people died from not having that.
Yeah. Thank you for sharing that. I know that this is not an easy topic. And, as we talk about risk and resilience, this is still so fresh. These are not conversations that are in the past. They're still happening now. So thank you for that. David, I know that you yourself had some turning points and some questions around what your role would be as you were thinking about your family, those outside, leaving the hospital, going back home. I know that you and I spoke a little bit about the difficulties of home life and all of those things that come with the work that you do. Can you just get into that just a little bit of how your work kind of filtered into the rest of your life?
Certainly. I mean, it was very challenging just not having our I think, as mentioned before, our just the strategies that I would normally use for self-care. We talked about friends and family, being able to go out for dinners, travel, going to the gym, all regular things that I would certainly do. So we're dealing with a very stressful situation and having to cope with it in isolation, in the sense that, the general public was told to, kind of stay with their families, bubble, have that around you, and then isolate if you had a potential exposure. But when you're dealing with potential exposures on the daily, certainly no one wants to be around you. So you're looked at as a hero in one in kind of one vein, and then certainly looked at as like the virus when you're out in the community, and just people being generally scared. I really had to kind of shut down, and compartmentalize any worrying thoughts that I had for myself, to be able to continue to show up for work, and to be able to continue to help the public. And also mentioned before, just having that fatigue of dealing with that on the daily, that when you come home, not being fully there for your spouse or your significant other, and also to help in their emotional needs. And one thing that was just having the responsibility of working in the ICU with patients on 200% oxygen, prior to potentially being intubated, being one of the last physical contacts that they might have. I mean, family weren't allowed to come in. They weren't allowed to see their loved ones unless it was close to death, and they were having to view them through an iPad. So having that responsibility of being actual human connection to someone as they're potentially going through their ending stages of life, and having to tell them, try to calm their anxiety that things are going to be okay, when you really know that they're not. That's an incredible and very weighing responsibility to have had. So
yeah. I wonder if the three of you have had, we just listened to the research on resilience, and being able to kind of take the time to build your resilience, and to do the things that are important for that. And David, I think you outlined many of those things very well, being able to work out and see friends and family, and be those things that builds up your resilience. Have you all had the time or the capacity to be able to care for yourselves during this time, and what are those things that are you're holding on to, or those moments that you can hold on to keep you going? Aram, can I start with you? Is that okay?
Yes, that's fine. I would say for me, I'm a very spiritually inclined person. I really believe in a lot of power and strength in meditation and prayer. And I really believe that is what kept me going through my very difficult times while my father was hospitalized, when the pandemic had even started. I would say that was something that kept me going while my father was hospitalized, and I was working alongside with other patients that were simultaneously on life support as well. For me, I feel like that is a great resource of strength. And that is something that really kept me going. The pandemic did have a lot of restrictions in terms of having to physically meet people. Speaking with people on the phone or having anything virtual was I would say, a bit of a challenging issue. And I would say that on behalf of my colleagues, for instance, because I think a lot of them had been going through so much personally. Each individual copes differently. So the way that they respond or react to stress is going to be vastly different from each person. I would also say a lot of other things that kind of helped me with coping were, I would say, a lot of writing. I'm very much into writing, and music. I like, I've played a lot of musical instruments, and I would really feel like that was my circle or space of Zen, for me to have that moment for myself, to really indulge and just have that inner peace, to try to align that inner peace within me.
Yeah. How about you, Todd? Have you had the time, the capacity to care for yourself, and what have you been doing?
That's such a good question. And when I reflect on that, I really have to say I'm unsure. Unsure because being in the healthcare system, I saw and witnessed so many inequities that it still sits with me, right? You see it and you don't know what to do, and you're experiencing this moral distress or moral injury. how do you heal from that? Sure, sleep helps, taking time away helps, but being in the healthcare system, you're kind of reminded, okay, we need to make some change. So I think that self-care is one thing, but I would say it's the responsibility of the organization as well to support us after this experience, because they did such a great job as just putting people all together, organized redeployment, you're going to do this, do that. But I think that same energy needs to be deployed for management of how to take care of your team, how to build back better, how to promote a sense of mental well-being in your team. And just going back to the presentation that Mina did was the organizational level of perhaps being more transformative leadership, promoting more sense of mental well-being and support, and really making that a priority somehow. So I think it comes from within ourselves to take care of ourselves for sure, but also coming from our organization as well.
Mm-hmm. David, do you feel like your supports, your organization is helping you along that journey to to give you that capacity to kind of take care of yourself, or to, are those systems in place for you?
Well, that's it's challenging. I mean, although I've been able to, do some personal stuff with regards to self-care, going back to, being active, working out, I really certainly went to education and to really to give myself some control, like going to literature, learning about the virus, and with each new strand that was coming out, and to give myself a little bit of control in an environment where there was little. It's been challenging though, because I mean, the state of our healthcare system we've gone from a COVID pandemic to a pandemic of staffing. And that's been challenging for us. I certainly know that, organizations, have job postings out and have had them up for months and years, but there's very limited that, we can do when there's just no people that want to do the job. And so now we're moving from our secondments and dealing with the severity of COVID itself. And now we're going into just an onslaught of trying to clear the surgical backlogs and the constant push to, try to move through it quicker. And, and you're also working with more challenging, patients and families who haven't had the appropriate level of care for the last 2 to 3 years. And doing that with the same, very same level of staffing that was there prior, which has been limited, is certainly has been challenging. And I know it's something that all organizations, are trying to correct. It's just, certainly difficult when there's just not enough of the skilled people wanting to take the positions.
I have no doubt that this has been the most challenging period in your work lives. But you're all still here. You are still working, you're still getting up and going to your jobs. And I wonder about where hope lies in all of this for you, and why it's important to just keep on keeping on as you're doing. Todd?
What keeps me going is the connections that I make with the people that I work with, the clients, the patients, and my colleagues, because I realize that that's my second family. I have my own family, but it's the work family. And just going back to the first question of why I went into the field, I love the contribution that I make to people's lives, and that keeps me going. And also being curious and being in the healthcare system, how can I contribute to make it more equitable? Because I think it's everybody's responsibility now, not just the leadership team, but for me now, after experiencing COVID, the pandemic is, I need to voice biases. I need to communicate from a bystander if things are not ethical, not equitable, that sort of thing. So I think now I have a different lens of going into this from the next chapter of my life, of my career, to how can I make a positive influence in a different way this time? so that we
Yeah.
can learn from the pandemic and not make the same mistakes. So coming from that angle is would be strength-based focus versus from a pessimistic point of view of healthcare, because we can go there. But I think I'm focusing more on the strength of healthcare.
Yeah. With the thank you for that. With the few minutes we have left, what about you, David? What is keeping you in it and giving you hope these days?
Well, it's interesting listening to the talk about resiliency. So I am getting older, so my resiliency builds certainly builds with age. But
Right.
yeah, but no, it's still coming back to why I went into the profession in the first place, and having that ability to certainly help other people and family. I mean, my secondary job that's kind of popped up has been a healthcare navigator for friends and family in this time, just because our healthcare system is certainly very fractured from where it was before, and just trying to get appropriate levels of care afterwards has certainly been challenging. I just really hope that from higher levels of government that we learn from this, whether everything was truly heated after the SARS pandemic, and in 2003 was really carry forward, and there was certainly a lot of questions about that. So I really hope that I hope that we have good people in place that can really push forward and really learn from this, try to support the front lines, certainly looking at staffing models, not trying to do more with less. And I have hopes that will happen, and we'll just have to keep soldiering on.
Yeah, for sure. And you, Aram, what is giving you hope? What's keeping you getting up and doing the work?
I would probably say that we've already been through such a difficult battle. So why stop now? Why stop now? I would also say that it is to continue the legacy of my late father, because I know it's something that he really wanted me to do and continue. And I know that he wanted me, and I know he always would say that I know that you will shape and change the world for a better place. And I think lastly, what I'd like to add on to that is, given this experience, um, you know, SARS and Ebola, for example, those were like um, our wake up calls. And I think getting input from individuals such as ourselves is what mistake are we going to avoid for the future, and try to implement programs, for example, such as emergency preparedness programs of what mistakes we made and what things could be done better. Implementing EAP programs and mental health awareness programs and support groups for healthcare workers at the start of a pandemic. It's long overdue. You know, things like that, for example, because so many lives have been lost, and I just think that it could just have been managed so much better. But I would say that to implement and shape the world into a better place, and just that change for a better tomorrow.
Yeah. Thank you
Yeah.
all so much, Aram and Todd and David. And I wish you the best as you push forward in taking care of us. And I thank you for not just taking this time in the symposium here, but for the work that you do. Thank you for being here today. It's much appreciated. Hello, welcome back, everyone. I hope that that you had a short break and you put it to good use. We have learned so much in our morning session, in the early parts of the symposium, about risk and resilience through the personal lens of our generous healthcare providers and the panelists, and through the data and recommendations coming out of the research. I have to say that I'm learning so much about PTSD, about moral injury and risk, and my own resilience. But I understand that we do lean on you all the most, and at our most vulnerable times. So it's good to really take a step back and look at what we can do to help to alleviate some of this burden and this stress. We're going to continue this conversation with colleagues from the University of Alberta who will present a tool called the Matrix that aims to, in part, move individuals from negative psychological distress or behaviors to more positive behaviors. Dr. Suzette Brémaud Phillips and Dr. Lorraine Smith McDonald can give you and give us a bit of background on the Matrix. I'll turn it over to them.
There we go. Can everyone hear me? Is it okay now? Okay, wonderful. Sorry about that. So I just wanted to say thank you so much for that introduction. And we're very excited to be here. And as already has been mentioned in the symposium many times, we just want to acknowledge both the risk and the harm that has come out of the pandemic, whether that's with PTSD or moral injury, or just any of those other components that people have had to experience. But I think we also just want to honor the moments of resilience that we just heard about in the last presentation, and to just really speak to the fact that as much as we know that risk comes, so too can resilience come. And we want to share a little bit about our definition of risk and resilience and how we believe you can build it. And so I will turn it over to Dr. Suzette Brémaud Phillips to just give us a little bit of an introduction about our understanding of risk and resilience before we move into the matrix.
Thank you, Dr. Smith McDonald. It's a pleasure being here. Thank you, everyone, for the opportunity. While there's a lot of different kinds of models of resilience, one way that we can look at it is to think of resilience and risk as two sides of the same coin. On the one hand, harm is anything that can challenge our core values, an external threat to us. Yet at the same time, despite that threat, we have the innate desire in our hearts to continue to move forward. Early on, we hope, even if the glimmer of hope is extremely small or hard to find sometimes. But with time, this harm can sometimes overcome our hope. And so there's a need to go deeper, to find a way to get through. We posit that resilience is about our values as well. To be resilient, we need to know what matters to us the most, i.e. what our core values are, and how we want to live out those values in our lives. If we don't care about something, it doesn't align with our values or who we want to be, then it's going to be very difficult to care or to carry on. Knowing what matters to us helps us to clarify where we put our energies or what things are worth fighting for, and equally importantly, what things we should let go of. Resilience is about trying to, in small steps, be able to realign with our values. In difficult times, we often lose sight of what we are trying to achieve or why we're doing things. Left unchecked, this can lead to helplessness, feelings of hopelessness, which further compound or can compound our sense of harm. Taking small steps to clarify what matters to us most, however, can provide us with greater understanding and a clearer sense of meaning and purpose, and a pathway to get through the harm that we're experiencing. And that's where resilience shines the most. So again, resilience is about our values, what matters to us the most. Back to you, Lorraine.
Great, thank you so much. We also just want to acknowledge, as has been discussed in this symposium, that resilience is something that is a joint responsibility between ourselves and other people, specifically employers and employees. And employers need to make those changes to be able to improve workplace factors that reduce mental health and promote resilience. So we want to just acknowledge before we get into the matrix specifically, that this tool, while being specific to individuals, can be used on a team level and can also be used in ways to support this more global and more societal approach to resilience. So before anything else, why don't we jump right into the matrix? This is a tool that was developed by Acceptance and Commitment Therapy, and it's an evidence-based tool to try and support people to move from risk to resiliency.
Hi, we're going to introduce you to a tool called the Matrix. The Matrix is a perspective. It's a way that we can look at things. And we can use the Matrix to understand our experiences and help guide our choices. Especially when we're feeling stuck, it can help us figure out how to get unstuck. So the Matrix has two axes. The first axis is towards and away. And this means towards what matters to you, towards who's important to you, towards your values, what's important and matters to you, or away from them. The other axis is inside and outside. Inside is our internal thoughts, feelings, and sensations, and outside is anything you can notice with your 5 senses or your own behavior, which is what other people can see you do. In the middle is us noticing, hopefully with some kindness and curiosity. And so it's important because it also helps us notice what's happening and to take a different perspective of thinking about things, not in terms of good, bad, right, wrong, true, false, but in terms of towards what matters or away from what matters. We can also use the matrix to understand risk and resiliency. So in a sense, risk is when we get stuck on the away side of the matrix. As humans, we often do things that are short-term solutions, but end up costing us in the long term. Resiliency is then getting to the toward side of the matrix. It means that we're doing things that are important to us, that matter to us, even when things are difficult. And our goal is simply to move a little bit more towards than away. Nobody can spend all their time on the towards side of the matrix. So now we're going to use the matrix and to give you an example of how you can use it. So now we're going to go through an example of how we can use the matrix. In this example, Dr. Jamie and I are going to use the matrix. I'm going to be using an example from my own personal experience. I spent almost 15 years on the medical, surgical, and cancer care units at the hospital, and I was there for part of the pandemic. And so as a frontline worker working in the cancer center during the pandemic, I'm going to use my own personal experiences to help us understand how we can use the matrix. So let's see how we can make use of this tool.
Hey, Dr. Dana.
Hey, Dr. Jamie.
Let's talk about something related to your experiences as a healthcare worker, especially the ways that you felt stuck as a healthcare worker.
Yes, so I would say one of the parts that was the most difficult and I get the most stuck on were some of the rules that really it felt like they were putting patients and healthcare providers at risk. Sometimes those were government rules, sometimes they were institution rules during the pandemic. Sometimes it was about PPE and when you could get it or how you should use it. Other times it was about when and where and who was allowed to go in and out of the hospital and where you had to work. And there was just constant worry about bringing the virus either in or out of the hospital, especially at early stages of the pandemic.
Yeah. So painful. So I'm gonna put this on the matrix, Dr. Dana, away from what matters, because this pain was really taking you away from the things that mattered, and in the internal world. So could you tell us a little bit about those painful thoughts and feelings and memories that you had during that time?
Yeah, there was a lot of anger and frustration. And I would say also really feeling helpless and sometimes hopeless that things weren't going to change. Sometimes we tried so hard to get those rules to change, and sometimes we made no progress at all.
And I also heard you say just memories of people, patients, and coworkers being harmed.
Yeah, it was really upsetting to, we all get into this profession because we want to help people. And here there are these rules that feel like they're harming both patients and our coworkers.
So thoughts like what was going through your head?
Like, this is unfair. I need to fix this. Why is this happening?
Any body sensations with all this pain?
Like constant tension, just all the time.
Mm-hmm. Okay, so lots of anger, lots of frustration, helpless, hopeless, great noticing. All right, so we're going to move up here. So this is away from what matters and what people see in the outside world. What did you do to move away from this pain?
Well, I would say we often got into arguments with management, trying to get people to change, try to convince people, of the importance of how things needed to be different. That was a big thing.
So what else did you do when you felt frustrated, hopeless, helpless?
Yeah, I mean, we often didn't get anywhere with that, so we did feel like super hopeless. I'm pretty sure I was like pretty snappy with my family members, and I probably started to like avoid some of my friends because they just didn't want to keep hearing about all of our stressors at the hospital.
Yeah. So what happens is these thoughts and feelings in the away internal, you started coping with them with these away outside, right? Is there anything that happened as a result of these away outside moves? Like, so while you're getting in arguments with management, trying to get people to change, getting snappy, avoiding friends, what pain did that add on the inside?
Well, you end up just feeling even more frustrated and angry because you can't get them to change. And then you start to feel like a horrible person because you're not, hanging out with your friends and you're being snappy and difficult with your family. Like,
Yeah. Okay, so great noticing, and notice what's starting to happen. These away inside experiences are contributing to these away outside actions, which are then leading to more away outside experiences. So we start to spiral on this side. And when people come to us stuck, they can be in a high risk situation where they're spiraling on this away side. So when we get fixated on this away side of the matrix, the pain and the ways we're managing the pain, and then trying to get rid of these as if somehow if we worked hard enough, we could get rid of them, we can stay just in this spin. So we've all been there trying to get rid of these things, and we know what we've learned can't be unlearned. And even if we could get rid of all this stuff, it still isn't getting us over here to the things that matter to us. So where we're really focusing now is moving to this toward side where we're living a meaningful, purposeful life, connecting with what matters to us. So let's move over to this toward inside world of yours with who or what matters to you.
well, I would say obviously my family and my friends matter to me. My colleagues and patients, they were important as well.
Okay, so that's who matters to you. How about what matters to you? What are some of those values that matter to you?
Well, again, I really got into this profession to help reduce human suffering, to make things better for people, to help them live healthier, better lives.
When we think about these values and we move up to this towards outside part of the matrix, we're looking at what could you do to live out these values and care for these people. And one of the things you said you're trying to do is change the system, help the system be more responsive, help the system take care of healthcare workers, patients. And you tried that strategy, it sounds like, to the nth degree. So that matters. And we're also trying to find other things up here that would help you live out these values. So when you think about these people and these things that matter to you, what else could you do to live out the inside towards quadrant?
Well, I mean, I guess I could definitely spend more time with friends and family and not be so grumpy around them.
Yeah. What else? How about taking care of your colleagues and patients?
Well, I mean, I think it was probably really helpful when we supported each other as colleagues and just recognized how hard it was. Often people who weren't in the hospital just really didn't understand what it was like to be there. And so probably supporting each other about how hard it was an important thing to do.
Right. So lots of ways that you were showing up with compassion that really made a difference.
Yeah, and similar probably for patients too, right? That everybody was scared and things were so uncertain.
Yeah, so comforting patients. Yeah. Okay, so notice you actually have some options here. It was super frustrating that you didn't get the support you needed from management, from the hospital, and understandably caused you pain because you want to make things better. You wanted people to have healthier lives. And you just noticed there's a lot of flexible ways that you can express your values. So we want a lot of different options up here because we find ourselves in contexts and external situations that limit our options. So resiliency on this side is really having quite a few ways to show up towards what matters to you. I want you to notice too, Dr. Dana, down here, these things that matter to you are the very things that are connected to your pain. So looking at anger, frustration, helpless, hopeless, because you cared about patients and your colleagues. Memories of people being harmed because you want them to be healthy and feel better. And this is not fair because you want things to be fair for these people. So your pain is directly connected to these values. And in that way, risk and resiliency are two sides of the same coin. We hurt because we care. So when you look at this whole matrix, what's it like to notice with kindness and curiosity?
Yeah, it's pretty clarifying to see it like written out all that way. And I can see that I was really getting stuck, in just one way of trying to do things, and that maybe there are some other things that I could do that are still important and helpful.
Yes. And here's what's important to notice. We don't get to get rid of the away side. Away side, the uncertainty, the pain of life is there for good. And yet we do get to focus on continuing to move towards a meaningful life, even with that pain, even with the ways that we're managing that pain. So today you noticed different ways to move to the towards side. And that's how we are resilient, even in the face of difficult situations.
So that was an example of how you can use the matrix to understand what's going on for us and to take a new perspective on how we can move forward. As clinicians, we use this all the time to help our clients and patients, but we also use this in our everyday life. Whenever I'm feeling confused or stuck or uncertain about how to behave, I will take out a matrix and fill it out to figure out what's important to me and how can I express that. We can really see how risk and resiliency are part of two sides of the same coin, that we can get stuck on the away side as part of the risk, and it's a normal human response. And resiliency is figuring out ways to make towards moves even when it's hard.
Yeah, the matrix has helped me really listen to my pain and find my values within my pain. So when I am feeling angry, what feels wrong to me that I could take valued actions on? When I'm sad, what can I mourn that matters to me? And if I'm scared, what can I protect that I care about? If I'm guilty, what can I repair? So my pain then informs my values and my valued actions instead of being something I need to react to and fix.
So we always take the approach that wellness is a joint responsibility between employees and employers. So although we don't have time in today's presentation, there is also a team matrix or a pro-social matrix, which is about how groups can work together and find their shared purpose or their values and move towards or away from that and understand that better. And so we want to empower individuals to do what they can to be well, while we also recognize that systems also need to change to help the individuals be well.
Incredible stuff. Thank you so much to Dr. Jamie Lusk and Dr. Dana Lee Bagley. And Dr. Dana is joining us today, along with Dr. Suzette and Dr. Lorraine are back. Thank you all so much. Talking about the problem is so important, but providing the tools to address those problems is crucial if we're going to change personal and institutional behaviors. And thank you, Dr. What was it like, Dr. Dana, to go through the matrix yourself? You gave so much of yourself, and I don't think that those answers were made up. I'm not thinking that.
Yeah, so I really do actually use the matrix all the time in my everyday life. So going through the matrix was a really common thing for me, but I think it really demonstrates how we can do it. We were really glad to have some real, lived experience to be able to share with the audience and how we could use the matrix with that lived experience. And so I think it's a great example with some, real data as to how you can make use of it to handle the experiences of frontline workers during the pandemic and hospital workers in general.
For sure. I want to just remind folks that the Q&A box is open to you if you have questions for the University of Alberta team here. I'm happy to express those questions for you right here. I do wonder about this. There is a question that came up about the group and team matrix that you did mention, and how that works, and how can you just either any one of you can you tell me just a little bit about how the team matrix would be applied in healthcare settings, how it might work?
So we've used it in a number of our interventions with healthcare workers, and it's really for kind of groups. So it could be a unit, it could be a department, it could be two people working together. And what it allows groups of people to do is to focus the conversation on values, which in the group setting we refer to as shared purpose. In groups, and in work settings, there is a shared purpose that people are there to do something together. And so it allows us to have conversations about shared purpose and values instead of, again, like right, wrong, good, bad, true, false. We've used it in work with conflict resolution to, again, change the perspective instead of like who's right and who's wrong in terms of what's going to move us towards and away. We use it in our diversity, equity, and inclusion training to help people change their behavior in their everyday lives, again, becoming more aware of the biases that show up and choosing behaviors that's more consistent with their values around inclusion. So there's a number of ways that you can make use of it, and it's a really versatile tool. Again, it's really meaningful to us, in addition to empowering individuals, is to help change the systems. We know that the systems are also contributing to burnout, contributing to moral injury. And so we don't want to just rely on the individual changing, we also want to help the system change. And so we've made use of that tool, for example, in leadership training, which is one way that you change the system is by helping leaders have better skills to manage people and to make decisions. And so there's a number of ways that we've made use of it in teams. Oh, you're on mute.
It's like I'm brand new at this. I'm really not. Can you just tell me how it's been received then in those settings? You say that that the matrix has been applied to so many different scenarios and groups. How has it been received? Has there been uptake in the way? I know that you and Dr. Jamie have used it in your own lives. Tell me a little bit more about the uptake and how it's received.
Yeah, so I think it's been very favorable. We did a study on burnout during the pandemic. And again, we decided that we got grant funding to look at, burnout in frontline workers. And we chose to do a leadership training instead of, an employee training to, again, try to address some system level problems. And that was the structure of all of the intervention, was using the matrix to help change behaviors of leaders. And so it's been really, really well received. One of the things the matrix does is actually create psychological safety. And so that's sort of been mentioned in some of the earlier talks as well about lacking psychological safety. And it's actually a tool that teams can use that builds psychological safety because it allows people to have a conversation about difficult topics in a safer way. So we don't have to point out like, well, you did this or you did that, or this was bad, or you shouldn't do that. We can simply say kind of, well, that felt like a towards move for me, or that felt like an away move for me. And sometimes, people are trying to do towards moves and they're interpreted as away moves. And so it gives a team a language to use that is really more compassionate and more flexible and more curious and open, and doesn't have to get into like right, wrong, true, false, good, bad.
Right.
And it's sort of one of those earworms, once you hear towards and away, like it's hard to forget it.
Absolutely. Absolutely. Dr. Lorraine and Dr. Suzette, have you been applying the matrix to your lives?
Yes, absolutely. As Dr. Dana just said, it's amazing how familiar this idea of towards and away becomes. And as Dr. Dana said, I think it's a really nice way to sort of ask yourself, why am I doing this behavior, right? And what does it mean to me that I am doing this behavior? And so for me personally, that has been a great way to clarify, why am I doing certain things? And really to be able to look and say, is this towards what I care about? As Suzette said, is this something that's meaningful to me? Does it move me in the way that I want to move in my life? Or is it really taking me away from that, even if it's a short-term experience? So it really has helped me to really clarify that meaning and purpose in my life in really small ways, really tiny things that I'll ask myself, like, work decisions or personal decisions. So yeah, definitely I've used it.
And I would just
telling
echo,
you.
I would just echo that if I could, Garvia, in
Yes.
terms of just being empowering. So a tool that I use as well in terms of making those choices. So looking at, do I go this way or do I go that way? It's within my control. And so reminding me of my choice. And so I find the tool very empowering, and also challenges me to be more aware, more self-aware, and more collectively aware of what choices we're taking, how I choose to look at something, what other options I have. So for me, it's an awareness tool as well as a choice tool and a team building, and as Dr. Dana mentioned, as well, a way for people to have a safe way to not look at blacks and whites or blaming or otherwise, but to really have an open mind about seeing things in a broader perspective. So empowering, choice, breadth, about me and about we, and really keeping that focus on two sides of the same coin and looking at where those pains are also the things that truly matter, and how if I root into those, I can be more resilient in even the most difficult of circumstances. So I think for me, it's a lens through which I look all the time to be able to make the choices that I do. So rather than a tool, for me, it's a way of life and a lens through which I look at every moment of every life about, do I choose to move this way or that way?
Amazing. I feel like the Matrix is something that I'm going to take back to all of, my own teammates and my own life, and put it on the fridge and all of the above. It really is. One thing that I find really fascinating is the idea that the Matrix helps to clarify your values and how values link with resilience. So I'm wondering if you could just unpack that just a little bit more, so that we can be left with a clarity in that, how the values are linked with resilience, and then how you can get to that through the Matrix. Dr. Dana?
So one of the great parts about the Matrix is it is an evidence-based tool, and it's built on, a well-supported intervention known as acceptance and commitment therapy that's been shown to address a number of conditions, from things like depression and anxiety. Our team used it for moral injury, but also even things like OCD and psychosis, and then things like procrastination and parenting. And so it's a very versatile therapy, but well established, that we know that it works. And so values is part of that model of therapy. And values has a very kind of specific meaning in the therapy, is that it's about how you want to show up as a person. And that's really important, because it's not sort of like, what do I want to get out of life? But it's like, what do I want to contribute to life? How do I want to care about people? How do I want to show up? And that's a much different thing to think about, because then it's about your own behavior, and you have much more control over that than the environment or, the way the world is responding. And so, for example, sometimes, there was people who would say freedom is a value. And the question was, well, what would you do with more freedom, right? Because the values part is, how would you show up? If that's important to you, what would you do more of or less of if you had that? That's how we kind of talk about the values. And so there's Dr. Jamie did a great example of that. There's this expression about, where there is pain, you'll find your values. And so it's the two sides of the same coin, that when something is really painful, it also tells you what's important to you, and it can give you clues and about, what matters to you and how you want to show up. And then the secret sauce is, then we want to find flexible ways of expressing that. We often get, into very narrow definitions of, like, this is how I have to show up to express that value. But we're trying to find lots of different ways to express our values. And that, I think, is really important in this world, this like post-pandemic world that is way more uncertain. And there is a lot of things that are less predictable than they were beforehand. And so having that psychological flexibility to show up in a variety of different ways to express your values then gives us a lot of ways to move forward in a meaningful way.
Yes. Thank you so very much for this. This has been such a paradigm shifting in your head, you know, how something shifts something. The Matrix is really quite fascinating. If anyone wants to take a look at the template, you can look at the chat right now. There's a French version. It's also in other languages. There's an English version here in the chat. You'll see that, and you can just copy and paste that. There's also a question here about a link to the group and team matrix, which I'm sure that we can provide as well. But I want to thank Dr. Suzette Bremo-Phillips, Dr. Lorraine Smith-McDonald, Dr. Dana Lee Bigley, and Dr. Jamie Lusk, who is not with us right now, but this has been fascinating. Thank you so very much for being part of the symposium day.
Thank you so much.
Thanks for the opportunity. Thanks, Dana. Thanks, Lorraine.
So the University of Alberta doing some really incredible things. I love it. Now, if you can believe it, we have come to the end of symposium today. I want to invite again, actually, I want to thank everyone who has been a part of this today for taking the time and being so generous and open. Those healthcare professionals in the audience who took the time to take part and be in the symposium. I know those that were speaking, it takes a great deal of courage to share your experience. And then those in the research field that marry all that experience with this depth and breadth of research and offer up tools like the Matrix. I know that the work that you're doing is just so difficult, but so important. So thank you. I'd like to welcome back Dr. Margaret McKinnon for a short debrief on everything that we've heard today. We're just pouring in with thanks for all of the panelists and for the symposium. Dr. McKinnon, Margaret, this has just been great. I mean, can you, I know that you're intimately familiar with the research and the tools that were presented today, and you've heard so many stories. What has today's symposium taught you about risk and resilience?
Thanks so much, Garvia. And I just want to echo your words and thanking everyone who contributed today. It is not easy to tell these stories. It's hard to listen to them. But I think what I learned and was reminded of again today is that we're not alone in this. You know, in speaking to healthcare workers, we often hear that people say I feel so alone. I don't think other people necessarily are having the same experience as me or having the same reactions. And I think what we're reminded of here today is the community that we share and the work that we have to do together. And that includes organizations, individuals, members of government, policymakers. We're in this together to support one another, and just being reminded and knowing of these stories, knowing the tools that could help us, and working together towards a common purpose of supporting and strengthening our healthcare worker community.
Absolutely. If you wanted to have folks in the audience walk away with, just one thing today. I know there's many that we spoke about, and I know this is putting pressure on you because maybe I didn't tell you that I was going to ask you this question. But what would you want folks to walk away with today?
I know I've worked as a clinical psychologist in the past, and I think one of the most difficult things when we face trauma is often to reach out to others for support. I've worked with patients where even making a phone call is painful, it's difficult, it's hard. And I think certainly when we're in situations like this, we do have a tendency often to turn inwards. And what I want to encourage people to do is turn to one another. We're here to support each other. We have each other's backs. We're part of a community that's of service, who serves. And we want to thank you again, all of you, for your service.
Thank you so much. Now you're going to see up on the screen how to follow us here. And if you'd like to take a look at the research, there's the website, social media. It's all up there. It'll come up on the screen and you can follow along with the resources. Thank you again to FAC and all of the partners and sponsors. Thank you to everyone who has taken the time to be here today. We hope that you are leaving here with helpful takeaways. If you want to leave just one word in the chat about how you are feeling about this session, please do. It's always nice to see how folks are feeling. But as I said, please take a look at the resources that are here, and you can go back to this video at a later date. Thank you again for joining. Have a wonderful day, and thank you.